Good afternoon everyone, my name is Dr. Parveen Murria, one of the substantive GPs at Leicester. We are here to introduce you to the way the whole system works for general practitioners. So we use Nerve Centre as our computer system rather than EMIS or System 1, although we do have access to System 1, which is connected to the GP surgeries in the community, which I find very helpful because it's able to show us the information which is available to the patients, general practitioners. It is somewhat different working in the general practice. One, we see patients who are a little bit more poorly than you see them in the general practice. We're also able to do a few more investigations for them. For example, request blood tests, request x-rays, even CT scans if needed. And we obviously have the facilities to communicate with specialist doctors like medical consultants in the GPAU or even the A&E consultants if you need further assistance, as well as we're very well supported by the injuries team as well. We obviously have to be careful not to over-investigate. Ultimately, we have to work as general practitioners. If we feel that we're not going to basically discharge the patient and they ultimately will be admitted, then it's best to transfer them to the appropriate area rather than trying to investigate them in the general practice and holding them here. Ultimately, because we only have 4 hours before the breach, so if they're in the right place, they can be treated and investigated quickly and referred onto the ward. So the best thing about basically working here is if you are a newcomer, you're not used to the system, you can always ask for assistance from them, and also there's significant support from the Blue Zone nurse coordinator who can coordinate the care of the patient on your behalf if required.
Hello, I'm Chris Barber, the General Manager for the Emergency Department, and I'm going to talk briefly about induction for agency GPs. On your first day, please arrive with your agency ID badge so your patients know who's treating them. On your first shift, a member of the team will induct you to the department. This will include giving you a network login, demonstrating how our clinical system Nerve Centre works, and showing you how the ED process works. On arrival to every shift, you'll need to sign in the Blue Zone. When you sign in, you'll be given an access card which will help you to get around the department. This access card needs to be returned at the end of your shift when you sign out, and the Blue Zone coordinator can sign your timesheet.